This is a training video to go through the clinic setup in the ClinicDr application. We're going to start in the upper right-hand corner by clicking on the clinic menu and going into clinic setup. This is where information is stored that will go onto the claims for the clinic. Within the Edit Clinic Information page, we can see owner information, clinic information, as well as phone number, main email address for the clinic for correspondence, tax ID, and NPI. You'll notice many of these fields are read-only for the clinic and may only be edited by ClinicDr. Please contact your account manager within ClinicDr to make changes. Also within this page, we have your calling preference. This relates to how ClinicDr will follow up on your outstanding claims that are past 45 days since the most recent submission date to the third-party payer. This clinic is noted as all calls, meaning all third-party payer claims will be called on if there is no response after 45 days. The next area we'll go through is the scheduler and appointment settings. The scheduler and appointment settings allow you to customize your calendar with different appointment categories for patient and provider appointments. This clinic has been set up with an office visit at a default duration of 15 minutes, a new patient appointment with a default duration of 30 minutes, and also a provider reserve time for scheduling time for the provider outside of treating patients but still within the in time for the clinic appointments. To add a new appointment, we'll click on Add New, and you can add in an appointment name, description, default duration, whether the appointment type is for patient or provider, and also set an appointment color. The default category indicator means that that appointment type is set as the default appointment category, and when scheduling a patient appointment, this will be the default visit type that populates. The next section we'll go through is the treatment note settings. The ClinicDr application has many treatment note templates to use on patient treatment notes. You can click on treatment note names to view a template of the treatment note and decide which templates are right for your clinic. By clicking the checkbox for Active on Patient Dashboard and Active on EHR menu, that activates the treatment note template to be able to use within the patient file. You can also order the templates to show them in a specific order when going through the patient file. The next section we'll go through under the clinic setup of the clinic menu is the default statement settings. This is where you can set up a default statement type to generate in your patient's statement queue area when generating your patient statements. You can also select a return address for your statements, which is especially helpful if you use a PO box for your return address on patient statements. Lastly, any custom message you'd like to include on your patient statement can be noted in the statement message box below before saving. This concludes the first training video on clinic setup.